Good morning. I'm going to do an incentive spirometry, and so the first thing I'm going to do is check the patient's charts to see, especially if they had an operation done. That way we can get them on this treatment just to help them open up their lungs so that way they don't create atelectasis, no fluid gets filled in there, or excess air, okay? So the first thing I'm going to do when I get to the room, I introduce myself. Hi, my name is Amy and I'm a respiratory care student. And then I'm going to check their ID band to make sure I have the correct patient. And then I'm going to wash my hands and then dry them. And then I'm going to get their pre-vital signs before I do a treatment. So once I'm ready, and then I can do this. So here I have a volumetric exercise there. So here is a little machine. This will help them open up their lungs. This helps them practice, strengthen their lungs to get a good inspiration. That way it opens their lungs, expands them to where they need to be. And with every machine here, there's a chart. So for example, me, I'll be the patient here. And so there's a female and then there's a male. So right here, I would be either 20 and 25, so I'd be between 1900 and 1850. So then I would set it where it needs to be. But if there's a patient that's just got surgery done, I can start at a lower rate, just that way they don't overwhelm themselves, and that way they can work themselves up to that goal. So we can set them goals. So I'll just set it in between here, just to start off with. And as always with the machine, any different machine that you start with, you always check to make sure it looks okay, looks in good condition, doesn't have any cracks or anything. And then I would set the patient, if they are able to, try to get them up to where I can get them to get a good breath in and expand their lungs, so I can set them up. I can have them hold a pillow if they're feeling some discomfort from surgery. I can have them do that. Alright, so the first thing I do is set the mouthpiece. So here I have a mouthpiece. I have to make sure it's connected properly to here. No leaks will be coming through. And then there can be a machine that can connect to this to read the meter, like read it to see what the tidal volume is and to see how good their inspiratory rate is when they breathe in. So I'm going to instruct the patient. When I do this, I'll instruct the patient to take a nice deep breath in and exhale. And then when they go to breathe in again, take a nice deep breath and hold it for a few seconds until that gets stacked down to the bottom. Then take out the mouthpiece and exhale as normally. All right, so I'm going to instruct them to take a deep breath in and exhale, and then breathe in. And then that way I can see where their inspired volume is. And if they can't quite get to where it needs to be, we just start them at a lower, we'd lower it down, and then we can set their goals. We need to do this every hour just to keep their lungs functioning. That way, especially when they're bedridden or anything like that, they need to keep their lungs working properly. That way they don't get any lung infections or anything like that. So when I'm done, I will remove this. I can wash off the mouthpiece and clean it and dry it if they are completely done, and I can cover it up. That way it protects it from anything getting on it. Place it in an appropriate place. And with this, if they're ready to go home, or even when they're in a hospital stay, you can put the patient's name and the patient's room number and the date that I gave them the machine to start them off with. And if I notice their treatment isn't going very well, it makes them dizzy or anything, I can slow down there with the machine and just give them a break. That way they don't get overwhelmed and hyperventilated or anything like that. So when I'm done with that, I'll wash my hands again, reassess the patient, check their vital signs, check their SpO2, see, make sure nothing is off with that. Chart on the patient's charts that I've done a volumetric exerciser treatment with them after their surgery, especially if they are post-op, then I need to make sure they continue to use those lungs to make sure they don't get fluid filled or even atelectasis after surgery.